Welcome to MIPS Tips for Eligible Clinicians with the QPP News Team.
We're on tip number 2 of the top 10 tips list to prepare for MIPS. It's time to identify which providers in your organization are eligible to participate in MIPS.
That's quite a tongue twister there, Susan. I've heard that we're no longer called eligible professionals.
That's correct, Dr. Paul. Eligible professional, or EP, has been changed to eligible clinician, or EC. Healthcare clinicians gave feedback to CMS, and they felt that clinician described their profession more accurately. For the first 2 years of MIPS, 2019 and 2020, an eligible clinician applies to Medicare Part B professionals, including physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified nurse anesthetists.
So has CMS clarified what physician type is? I get a lot of questions from dentists and chiropractors about whether MIPS includes them.
In the current proposed rule, CMS defines physician type as doctor of medicine, osteopathy, dental surgery, dental medicine, podiatric medicine, or optometry, and with respect to certain specified treatment, doctor of chiropractic.
So as a practicing physician, I would be considered an eligible clinician. Sandy, do I really have a choice to participate or not?
Well, that's a great question, Dr. Paul. Before I answer that, though, I'd like to just make a clarification that when we're referring to 2019 and 2020 as the first 2 years for the program, it's really the first 2 years for the payment adjustment. 2017 and 2018 are the first 2 years for the performance period. So beginning January 1st, 2017, if you are an eligible clinician by the types that Susan described, and you're billing any professional services under Medicare Part B, then you will be subject to the payment adjustment in 2019. Now, in response to your question, do you really have a choice? If you would decide not to submit the information or the required data, you may be subject to the payment adjustment. Depending on how many Medicare patients that your practice sees, that can have a significant financial impact on even a healthy organization. So you want to keep in mind that the payment adjustment will increase each year also.
Okay, so the choice is to participate to avoid a negative payment adjustment and potentially receive a positive payment adjustment, or don't participate by not submitting quality measures, not submitting advanced care information, and clinical practice improvement activities, and the consequences will be a negative payment adjustment for that year.
I think you've got it, but it gets a little more complicated for the PAs and NPs in that first year, 2017. Since they weren't eligible to participate in the Medicare EHR incentive program, CMS doesn't expect them to participate in the Advancing Care Information portion of MIPS, which is the new term for meaningful use. The points for that score will be redistributed to the other 3 MIPS categories: quality, cost, and clinical practice improvement activities. Of course, we encourage all participants to fully participate in all of the MIPS categories. And beginning in 2018, PAs and NPs will be expected to fully participate in all 4.
Well, and to add just a little bit more information, we expect the Secretary of HHS to broaden the EC group to include other disciplines such as physical and occupational therapists, midwives, clinical social workers, and dietitians for the 2021 reporting payment adjustment year, which would be starting in the performance year 2019.
So Sandy, can you help me determine who in my practice is an eligible clinician?
I would be happy to. For every practice that I'm working with, I recommend that they start by creating a spreadsheet for that performance year, and in that include every provider that sees patients, their role, are they a physician, are they a nurse practitioner, PA, or dietitian, whatever, and then do they bill Medicare Part B professional services. I also recommend that they look at their past history. Have you been reporting PQRS for them and attesting for meaningful use? By looking at that spreadsheet, you'll be able to determine who actually falls into the category for a MIPS provider.
And I understand there's some confusion about how you even know if you bill Medicare Part B. Could you give us some tips on that?
Definitely. I recommend that first you go to your billing department or your biller and see if they can use their software to run a report on all claims that have been billed for the last year. That helps you to identify any provider who has billed a Medicare Part B. If they're unable to do that with their software, then reach out to your MAC or your Medicare administrative contractor, and they can assist with that.
So I think I'm starting to get it. Eligible clinicians who bill Part B Medicare for approved professional services will be subject to the MIPS payment adjustment.
Another great suggestion to how to prepare for MIPS 2017. Identify your organization's eligible clinicians. So to recap, tip number 1, educate and engage your entire team. Tip number 2, identify your eligible clinicians. And join us next time for MIPS tips number 3 on how to prepare those eligible clinicians for the MIPS program. Thanks again for watching the QPP News Team.